Hey guys, congrats on finishing week one of the Introduction to Health Careers course online. I just wanted to say that I thoroughly enjoyed reading your introductions and I regret not assigning you to reply to your classmates' posts, but I will, however, be requiring you to do this from now on just because I think it gets more of a discussion going and you get to know each other a little bit better. So I hope that you'll at least take a minute if you haven't already to read what your classmates wrote in their introductions so that you can start to get to know each other a little bit. I also realized that I neglected to post my own introduction, so here goes. Hi, my name is Sarah Shoemaker and I live in Saranac Lake, New York. I teach at North Country Community College at both the Saranac Lake campus and the Malone campus, and sometimes through video to the Ticonderoga campus, so really all three. I prefer face-to-face teaching in the classroom as opposed to video conference or this online format, but I'm still in the learning curve really for online instruction, which means I'm really seriously open to any feedback you have throughout the course on how I can do a better job. Before I began teaching in 2010, I was actually on my way to become a research scientist. I did lab research in the area of microbiology. My degree is actually in molecular and cellular biology, so that's sort of my relation to healthcare professions. As it turns out, I really didn't like doing research, so that's one of the reasons why I moved into teaching. And one of the reasons that I actually designed this health careers course was to help educate students like yourselves about alternatives to the programs you may be currently in or pursuing, because maybe you changed your mind like I changed my mind. And it would have been really helpful for me to have had a course like this to know about all the other professions that are out there. So I've actually learned a lot myself about different healthcare professions in the process of creating this course. And although I really love what I do find it really, really comforting to know about other professions that might suit me if my plan A happens to fall through. So hopefully, even if you guys already know or are in a profession that you love, you never know, life circumstances can cause you to change your plan, and so it's nice to have a plan B. So let's see, as far as hobbies go, I don't really have any these days, but I used to be a runner and a triathlete, and I'm kind of trying to motivate myself to get back into those things because I really loved them. This is my family. I have an amazing husband, two amazing stepsons, and an adorable daughter. So that's me in a nutshell. All right, so your week one assignments were relatively short since it was a short week, but there was also a variety of things. I do like to incorporate a lot of different learning tools to help get topics across, like short YouTube lectures or videos, articles that you read, or small research assignments, and also creative or critical thinking written assignments in the forums. So this first week, I really wanted you to get to know the Moodle Rooms platform, make sure you knew how to access assignments, but also, of course, learn a bit of content. And the content or the topic this week was about how medicine and healthcare have evolved over time. And I also wanted you to be able to appreciate that even 60 or 70 years ago, things were very different in medicine and healthcare. I asked you to consider these differences from a patient perspective. And I really enjoyed reading your stories and seeing your interpretations of how they may have gone differently in a different era. A lot of you shared your experiences with childbirth or common types of surgeries like tonsillectomy or appendectomy or ACL surgery. So I hope that this assignment made you all feel very fortunate for the medical advances of the 20th century. What I didn't really have you explore was that things were also very different from a medical practitioner perspective as well. In 1950, there were not as many healthcare professions, including many professions in the field of therapy, like physical therapy, occupational therapy, and also technician jobs were not really existent until starting around the 1950s. These fields really came about from a need to take some of these job tasks away from physicians so they could focus on their more advanced skills. Another important area of development in the 20th century was the area of law and ethics in the field of medicine. In 1950, there were virtually no laws protecting patients' rights, so there were rarely lawsuits against doctors for malpractice, which is common in today. So also in 1950s, doctors were allowed to do things like prescribe placebo medications, like sugar pills. They were also allowed to lie to patients about terminal illnesses for fear that it might distress them. So they could tell a patient with cancer that was untreatable, oh, you're fine, you'll be fine, when really they're dying. But they were worried that the news that they were dying might distress the patient, so they thought it was ethically correct to lie to them. That is not okay today. Another practice that was okay in 1950 was to communicate over female patients. So information about a female patient may be communicated actually directly to her husband or to her father instead of directly to her. So there were a lot of differences in legal and ethical issues in medicine in the mid-1900s. So in this week, week 2, you'll be learning more about the legal and ethical standards in modern-day healthcare. You'll also be researching one of the major historical cases of ethical infractions that led to the modern-day laws about patient consent. And although it's not one of your assignments to do this, I do hope that you take a moment to imagine again that you are a patient in 1950 and how you may have been treated differently from an ethical standpoint rather than the medical standpoint. Another area of healthcare that changed drastically during the 20th century and has helped to shape our modern-day healthcare system is the availability of health insurance, which arose in the 1940s. So health insurance and affordability of healthcare are prominent issues in modern-day politics, and they're important really for every patient and healthcare provider to understand. Thus, part of this week's assignments are to help you comprehend health insurance a little bit better. So check out the to-do list for week 2. It's a little longer than week 1, so pace yourself and remember that everything is always due on Middle Rooms by Friday night. And if you have any questions or concerns, please don't hesitate to contact me. Good luck!